Welcome to The Explainer. Today, we're diving deep into a condition that, for millions of people, turns the simple act of breathing into a daily challenge. We're talking about chronic obstructive pulmonary disease, or as you probably know it, COPD. For so many people, being out of breath isn't just what happens after a tough workout. It's a constant reality. It's a feeling that points to a diagnosis of COPD, a progressive condition that really changes how you live and breathe. And understanding it, that's the absolute first step. All right, so here's our roadmap. We're going to start with the basics. What even is COPD? Then we'll get into the signs and symptoms, how it's diagnosed, the different stages, and of course, how you manage it. And we'll finish up with the most important part, the key factors for survival. Okay, let's start at the very beginning. What are we actually talking about when we say COPD, and where does it come from? So the first thing to get your head around is that COPD isn't just one single disease. Think of it more like an umbrella term. It covers a bunch of progressive lung diseases. You've probably heard of emphysema and chronic bronchitis. And the one thing they all have in common is that they make it harder and harder to breathe over time. And look, when it comes to the cause, the source material couldn't be clearer. While there are a few other risk factors we'll touch on, the single biggest one, the one responsible for the vast majority of cases, is smoking. There's just no way around it. But it's not the only cause. There's a rare genetic condition called alpha-1 antitrypsin deficiency that can lead to COPD. And also, think about long-term exposure on the job. Breathing in dust from things like coal, grain, cotton, even cement, day in and day out, that can do serious damage to the lungs and lead to a diagnosis too. So, what does this actually feel like? What are the signs that someone might be experiencing in their everyday life? Well, it often sneaks up on you. It might just start as a nagging cough that brings up phlegm. A cough that just never seems to go away. But then, the real hallmark symptom kicks in, dyspnea. That's just the medical term for shortness of breath, especially when you're trying to do something active. As things get worse, you might hear some wheezing, and in really severe cases, you can even see signs that the heart is under strain, like swollen ankles. So, if someone's dealing with all that, how do doctors actually pin down a diagnosis? Well, it's not just a guess. There's a clear path to get there. Doctors use a few key tools to build the full picture. The star of the show is a lung function test called spirometry. Then, they'll use a chest X-ray to get a look at the lungs and rule other things out. And finally, a full blood count and checking your BMI give them more clues about your overall health to really complete the puzzle. Now that spirometry test is the real clincher. It measures how much air you can force out in 1 second, that's your FEV1, compared to the total amount of air you can breathe out. If that ratio is less than 70%, even after you've used an inhaler to open your airways up, well, that's what confirms the diagnosis. It's a clear sign that something is blocking the airflow. And the chest X-ray? It does double duty. First, it helps make sure it's not something else, like lung cancer. And second, it can actually show the physical tolls COPD has taken, like hyperinflation, where the lungs are just stretched out because they can't get all the air out. It can even show these large air pockets called bullae. Okay, so once you have a diagnosis, the next big question is, how severe is it? And this isn't just about giving it a label. This staging is what guides the entire treatment plan. COPD severity is broken down into 4 stages. And it all comes back to that FEV1 number we were just talking about, how much air you can exhale in 1 second. So stage 1 is mild, where your lung function is still over 80% of what we'd expect. From there it goes to moderate, then severe, all the way down to stage 4, which is very severe, where your lung function is less than 30% of normal. And when you see it laid out like this, in a chart, it really hits home. You can just see that steep, steady drop in lung function as the disease progresses through the stages. That progressive loss of airflow, that is the core challenge of living with COPD. So what do you do about it? A diagnosis is definitely not the end of the road. It's really the beginning of a proactive plan to manage the condition and live your life. Now, treatment is not a one-size-fits-all deal. One of the first big questions is whether a patient also has features of asthma. If not, the main goal is just to open up the airways as much as possible, usually with 2 different types of long-acting inhalers. But if there are asthmatic features involved, the whole strategy shifts to also include an inhaled steroid to really fight the inflammation in the lungs. For people with more advanced disease, inhalers might not be enough. That's when a really critical intervention comes into play, supplemental oxygen.
But the big question is, who actually needs it?
Right, so not everybody with COPD gets oxygen. The criteria are actually very specific. It's generally for patients whose airflow is severely blocked, we're talking an FEV1 below 30%, or for people whose blood oxygen levels are consistently dangerously low, something that has to be confirmed with very specific blood tests. And this part is absolutely not negotiable. It's a huge safety issue because of the extreme fire risk, and frankly, because smoking directly undermines the therapy. Long-term oxygen is only given to people who have quit smoking, period. All right, let's boil all of this down to the absolute bottom line. When we look at all the possible treatments and lifestyle changes, what are the things that have been proven to help people with COPD live longer? If there is one thing, one single intervention that stands head and shoulders above everything else for improving survival, this is it. For any patient who still smokes, quitting is the most powerful thing they can possibly do to change the entire trajectory of their disease. Now, beyond quitting smoking, there are two other big ones that are proven to help. Long-term oxygen therapy for patients who meet those very strict criteria has a real survival benefit. And for a very specific select group of patients, there's even a specialized surgery that can make a huge difference. So now you've got the framework for understanding COPD. But just knowing this stuff is only the first step, right? The real journey is about being proactive. So with everything we've just covered, what's the most important question you can ask your doctor about the health of your lungs?